In the way we count Canada's COVID-afflicted, Rebecca Hogathorpe is said to be recovered. Sure doesn't look like it, though.
I just felt like I didn't recover. I was plagued with chest pain and exhaustion.
She tested positive 9 months ago. The virus now gone, but a long list of life-altering symptoms remain.
There was quite a bit of scarring on my left lung and pneumonia. Then my legs gave up on me. All of a sudden I started vomiting around the clock and other GI symptoms. My kidneys were injured, all possibly COVID related because of my weakened immunity.
A year ago, Rebecca was an active 40-something, a music teacher and sometimes interior designer. But now, as one of Canada's thousands of so-called long haulers, she's been in and out of hospital, unable to work, drive, grocery shop, you name it.
I almost don't even want to ask this, but do you worry that you'll never get better?
Oh yeah, all the time. It's been terrifying.
Recent research suggests as many as 1 in 3 who catch COVID could end up with symptoms that stick. For how long? That varies. So does intensity.
The midbrain here and then down into the brainstem.
All part of what researchers like Dr. Simon Graham at Toronto's Sunnybrook Hospital are finding. Evidence of strokes, bleeds, and inflammation. Other studies around the world also see COVID damage on the brain.
Enough people are going to be affected by this that we need to be thinking about it and putting structures in place in order to deal with it.
In, out, in, out.
Right now, we don't have much. Only a few specialized clinics for all of Canada.
Begin.
To help COVID long haulers who were never hospitalized recover.
Big, 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 and relax. Nice.
Okay, go ahead. Give it, give it, give it.
The clinic helps connect people to rehab and occupational therapy.
Folding in the legs with each one, push out, and then folding in the legs.
How fatigued did I feel?
They have them in the UK too, but more than 20 times as many of them, specifically for long haulers, and that begs a question for Canada.
Are we lagging behind?
We're definitely lagging behind. That may help.
Dr. Angela Chung opened Canada's first post-COVID clinic.
I do think we can do better.
What is needed?
Funding support to run these clinics.
Because right now, even the clinic you run is just run through research money. It's not even part of the health system.
That's correct.
It's time to change.
For sure, it's time to change.
If I do that...
Rebecca hasn't had any access to a post-COVID clinic.
Do you feel like the health system gets long haulers like you? Knows what to do?
No, they don't. Even the infectious disease doctors said there's nothing we can do.
I'm 22 years old, and I've been experiencing symptoms for the last 9 months.
CBC Marketplace interviewed some of the thousands of long haulers in Canada.
I just got off the oxygen about a month ago, so I was on it for a good 8 months. So,
Many, like Rebecca, unable to get the post-COVID help they need.
I said around $5,000 or $10,000.
Some are paying when the health system won't.
If I end up doing the MRI, that'll be another sort of $1,500.
This is all the walking Rebecca can manage today. Hopeful a health system overwhelmed now by the COVID infected will offer more help to those who still need it to recover.
I still am happy. I'm scared, but I'm still positive and I'm still a happy girl.
How?
Because I survived.
And she knows those who did not. Worries now about what her own future holds. David Common, CBC News, Toronto.